Hello and welcome to another episode of the PA Path Podcast. Before we get started, we'd like to extend a special thank you to our episode sponsor, the PA Education Association. Today we speak with Dr. Curt Stilp, Associate Dean of the College of Medical Science and Program Director for the George Fox University PA program. Dr. Stilp joined the George Fox University after spending time as the Director of the Oregon Area Health Education Center. He has also worked as a registered nurse and PA in general orthopedics and spinal surgery. He completed his Doctorate of Education and Educational Leadership at Portland State University and has research interests in interprofessional education, rural student training, and health professional workforce development. Curt, welcome. We're excited to catch up and reminisce and learn about your background as well.
Great. Thank you so much, Kevin. It's a pleasure to be here, and thank you for inviting me.
You're welcome. So let's start with our typical question. Tell us about your path to becoming a PA, if you would.
Yeah. I learned about the PA profession when I was actually in ninth grade in high school. I grew up in Minnesota, and in the wintertime, what you do in Minnesota is you are outside goofing around and having fun. And so I was with some friends and we were sledding, and I had a sledding accident, broke my arm, went into the emergency room, and a PA put on my cast. And I was just asking him about what he does and his schooling and all that. And so he really introduced me to the PA profession. Prior to that, I was thinking healthcare. Had a little bit of a leaning towards healthcare. I had several family members in healthcare, and so I knew I wanted to do something. But when I learned about PA profession, the PA role, and really interacted with this PA, that's really when the spark started within me. And then from there, over the course, obviously, of the next handful of years of high school, I interacted with several PAs. Some of them were my primary care providers. Some of them I just knew from acquaintances and from family members that knew PAs. And so I began to talk with them about the PA profession. And so I started to pursue that. And at that time, of course, there was not internet. One would write to a school and ask for a packet of information. And I knew that there was a PA program at the University of North Dakota. So I wrote to them, got a packet of information back about their PA program so that I could start to plan what the path would be academically for me after high school.
So tell us then about your professional career. Where did you go? And tell us a little bit about your clinical practice and then your foray into education.
Sure. Yeah. So then I got the information, as I said, from the University of North Dakota. At the time, as you may recall, the University of North Dakota PA program was specially designed for nurses. So I thought, nursing would be a good entry into healthcare in general, and then eventually on into PA. So I went to nursing school, and then about halfway through nursing school, I realized that there were other PA schools around. It was the early 90s when the internet started to come about. And so I was doing more research and realized that there were other PA programs besides that one. I continued on my nursing path, worked as a nurse for a handful of years, got some great clinical experience, and then eventually on to PA school. I went to PA school at Rosalind Franklin University in Chicago. And as many of us do, make great connections during our clinical rotations. And so I had a orthopedic elective and really connected well with the surgeon group and my preceptors. And it really just started to develop a love for orthopedics and orthopedic surgery. As a nurse, I had some interactions with some orthopedic PAs. Just the med surg floor that I was on happened to be a post-op orthopedic floor. And so I had gotten introduced to several PAs there to learn about their role in orthopedics. So after I graduated, stayed in Chicago and worked for a physician orthopedic group. I was their first PA. And so we learned a lot together about what it meant to have a PA and my role in their practice. And so over the course of 4 years or so before I went into education, my role morphed and changed as they continued to learn how to best use me from everything from in-office patient visits to first assisting to rounding to seeing patients in the ER or consults on the floor. And so then staying in Chicago, I kept in touch with several of the faculty at Rosalind Franklin, and there was an opportunity for me to do some guest lecturing in orthopedics. And Patrick Knott, who's the program director when I was a student and then program director at the time, invited me to do some guest lectures. And I came in and didn't know what to expect. And all of a sudden realized this is a lot of fun. I had a lot of fun preparing the lecture, delivering the lecture, and engaging with students. I just found that it really just, again, ignited something in me that really maybe I didn't realize even was there. And after I gave the guest lecture, Patrick came to me and said, hey, we have an opening for a full-time faculty position if you are interested. And so I debated that for a while, decided ultimately that wasn't quite the right time for me to do that. And so I waited for just another year, gave another series of guest lectures, and then I came to Patrick and said, is that position still open? And he said, yeah, actually it is. And then I joined the faculty at Rosalind Franklin full-time. I still maintained 1 day a week of clinical practice, and that's when I transitioned into spinal surgery, and so did that 1 day a week over the course of the next 3 years while I was learning how to be a brand new faculty member with great mentors around me, including Patrick and others at Rosalind Franklin.
So I'd like to go back to something that you said and ask you to expand on that a little bit, because I don't think it's an uncommon experience for new PA graduates going into the workforce. And that is that you had some educating up to do when you entered into clinical practice, and the physicians that you worked with had never had a PA before. And I'm sure they had a lot to teach you as a new graduate, but you also had some things to teach them. So maybe you could speak to our listeners a little bit about maybe some tips on how to manage that if you're a new grad going into a practice with docs that have never worked with a PA before.
Yeah, as you noted, it was a learning experience for us both. Being a new grad, I knew what my skills were, and I knew how I was trained in what I could do in terms of first assisting in the OR and seeing patients in the office. Where a lot of the learning came in was, how do we bill for you? What can we bill for? How do we set things up so that we're maximizing our reimbursement for the services that you're providing, and also not having you engage in things that maybe aren't going to be reimbursable? And so we spent a lot of time learning that together. Obviously, we engaged a lot of the office staff, so the clinic manager, those that did the coding and billing for the orthopedic practice. We spent a lot of time with them, researching, looking things up, figuring out what was billable, how should we bill for it, what codes, all that kind of stuff. And obviously, things have morphed and changed since that time in terms of a lot of those things. But those early years were spent really with sometimes the non-providers in the practice and having discussions with them and doing some of that research. And then as a result, saying, okay, let's change how we're going to use you. Let's have you do more of this and less of that. Or let's have you, whenever you go and see a consult, make sure that you are documenting these appropriate things so that there is a reimbursable type of service that you're providing. Or if you go and put on a cast or put on a splint in the ER, you need to make sure that you're getting this certain information, and then you report that back to us so that we can submit a consult bill for you. Outside of that, the mechanics of what I could and couldn't do, I think that was pretty straightforward. A few of the physicians had worked with PAs in residency, so they were a little bit familiar with them in terms of just the role that they would do and some of the duties that they would perform. But sometimes that involved talking with other physicians in the hospital system, the internist in that I would go and maybe round down those patients or do a pre-op history and physical, and they would be like, who's this person? What are they doing? And sometimes it would take educating the physicians in the consult service and or some of the primary care providers that I was seeing their patients, especially if they were in the hospital for evaluation of a fracture or something like that, and then we'd be doing surgery on them. I would need to go and introduce myself and talk to them about my role. So sometimes the education came to those around me. And then certainly the hospital staff, the nursing staff, in that, again, had some PAs in and out a little bit, but really this was the first consistent PA presence that they had specifically on the post-op orthopedic floor in the hospital. And so it took some educating of the nurses as well about, hey, I can write orders, you can call me for things. I was oftentimes a little bit more available than the surgeons were. And so quickly, folks got used to contacting me and learning what my role was and utilizing me as a result.
Curt, the thing that struck me when I was in hospital medicine as an internal medicine PA, and at the hospital I was at, I was the first or second PA there. But when the first orthopedic group brought in, I don't know if you remember Jen Wegler, but Jen is an orthopedic PA who had taught at Midwestern, taught at USC. I remember two things about that. One is suddenly the doctors were freed up to do 2 surgeries at a time because they had a PA in each room doing first assist. So they were no longer first assisting each other. Yep. Unless there was a really complicated case. So I think that the unanticipated component of revenue is suddenly their OR days were now producing twice as much revenue because of the PAs in the room, which maybe they didn't always give the PA credit for. Financially, you weren't getting necessarily a bonus towards that because at the time you couldn't direct bill for your first assist. But the other thing that really struck me was funny that I had an orthopedic surgeon rounding who came up to me and said, man, you PAs are really cool. I said, thanks. Why would you say that? He's, my PA just diagnosed a DVT in our circle, somebody we've been taking care of. And my first thought was, oh my gosh, you're a surgeon and you can't diagnose a DVT? His point was our general medicine training was really helpful for him because look, once I became an orthopedic fellow, my focus was mainly on instruments and cutting up bone, drilling bone, things like that.
Yeah, in subsequent clinical work with other orthopedic groups that I've worked with, they have really appreciated the PA's generalist training, especially when it comes to evaluating their patients for anything medically. So I settled into, with a later orthopedic group, I settled into doing a lot of pre-op H&Ps. I had a stethoscope. They didn't. And so I would go in and do a thorough heart and lung, and I would pick things up sometimes. And so they really developed an appreciation for the medicine that I could do, as well as obviously the surgical aspects and surgical techniques as well. So yeah, that's it.
You had a stethoscope and they had a hammer.
Exactly. I remember one time I wanted to look in a patient's ears and I was looking for an otoscope and could not find an otoscope in the entire orthopedic clinic.
As a fellow ortho PA, I can definitely relate to that. So, Curt, I want to give a little bit of a nod to something that the PA education community is really known for. For our listeners, it's probably a little known fact that Curt and I kind of go way back. I first met Curt when we both were signed up for a new PA faculty workshop back in the day. And I've always felt a little bit of a connection and a kinship from that with Curt and others that were in that cohort together, because I think we all started together and became a bit of a resource for one another. And those sorts of opportunities really allow new educators to create a community and to have a network of people they know that they can reach out for. And I think that's something that's really perhaps unique, but definitely characteristic of the PA education community, that those networks are purposeful and they're strong and they're enduring, because we probably don't want to say how many years ago that was, but it was a lot of years ago.
I think that was Puerto Rico.
It was Puerto Rico, yeah. It wasn't a terrible place.
2005. Wasn't that 05?
It was.
Yeah, it was. Yeah. That was my first PAEA conference, was Puerto Rico. And I thought, wow, this PA education thing is pretty awesome.
I had the same experience. I started in education in July and they said, we better get you signed up for the education conference quick. And I was like, oh, okay, great. When's that? Oh, it's in September. It was in September back then. Okay, where is it? It's in Puerto Rico. And I thought, I suppose if I have to go there, I can go there. But
yeah. I was just going to say that the new PA faculty workshop, it's probably called something different now, but at the time and continuing to present day, I think it really does provide such an amazing opportunity for new PA educators. And now that I'm a program director, whenever I hire a new faculty, one of the first things I do, just like Patrick Knott did with me back in 2005, we need to get you to PAEA to the new faculty workshop. And the new faculty that I have sent there have said those same things, Stephanie. They come back knowing other PA educators that are in the same kind of boat and position, just starting this endeavor. And it does create a community that, as we know, you see those individuals time and time again each year at a PAEA education forum. And it's, hey, how you doing? And you have that camaraderie, that commonality that you and others went through at the same time. So yeah, I can't speak highly enough for that process, that workshop, and that opportunity to connect with others that are starting out on PA education as well.
Yeah, PAEA has been a really great partner for all of us, and just their evolution of growth to help us navigate the complexity of education. So it's created a culture where we share with each other, we share best practices, we freely give content to help other programs get set up. So it's a cool culture. Let's talk a little bit about because you were in PA education. Then you purposely left PA education to lead an AHEC, an Area Health Education Center. I'm not sure everybody that listens is aware of what that is and why it's important. So could we talk a little bit about that?
Sure, absolutely. Yeah. So the Area Health Education Centers, or AHEC, is a national type of network, meaning each state has an AHEC. It's a federally funded type of office through HRSA. And in the state of Oregon, the Oregon AHEC is based at OHSU, Oregon Health Science University. And so I was at OHSU at the time teaching in the PA program, and I was overseeing the clinical phase of education as the director of clinical education. And so I was starting to get introduced to a lot of rural preceptors, rural healthcare, and really fully understanding some of the hardships and challenges that rural healthcare providers face, as well as their patients. And the PA program started to interact. The AHEC in Oregon did a lot with rural health education, not specifically just for PAs, but it was for medical students and dental students and pharmacy students. And we started to interact with them, and they had lots of resources. They had access to folks that could precept. They had access to housing for our students. And so the AHEC in Oregon, and similarly in other states, really provides this really great network to rural clinics, to rural hospitals. So they're a resource to both the hospital and provider side, but they're also a resource to the education side, in that they, again, oftentimes provide housing. Oftentimes they have access to and or knowledge of a specific community and their needs as they partner with the educational training institutions in the state. So whether it be a school of medicine, a PA program, a school of nursing, pharmacy, dental, behavioral mental health, they really have firsthand knowledge of these are the primary needs of this community. Here are the important people in this community that can help you in terms of getting your students connected, getting your students placed with preceptors that want to eventually hire your students. And so as I started to interact more and more with the AHEC folks across Oregon, I started to realize this is something that I'm actually really passionate about, access to healthcare, specifically in rural communities. And at the time, the Oregon AHEC longtime director was retiring, and so there was an opening. And I talked to my program director, Ted Ruback, at the time about it, and he really encouraged me and said, Curt, I think this would be a really amazing opportunity for you to take a step in leadership, but also to step into something that you are passionate about. So at the time, I was also in the middle of my doctoral education, and my dissertation was starting to take shape and to be about rural IPE. And so there just seemed to be this coming together of my research interests, my personal passions, and then an opportunity through being the director of the statewide AHEC to utilize leadership skills, my PA education experience, my administrative skills that I was using as the director of clinical education at the time. And yeah, so I applied for it. I got the position. I was the first non-physician in the state to be the director of the AHEC. And yeah, I stepped into that and honestly just continued all of the relationships that I had been building as the director of clinical ed for the PA program. I continued with all the same people that I was already interacting with, just in a slightly different role. And each state AHEC has to either be based at a medical school or a nursing school. And right there's obviously a strong connection to the health education of the state being matched up with the needs of oftentimes rural and certainly underserved areas within the state. The other thing that AHECs do is they do health education further up the line, meaning they oftentimes engage with local school districts to provide health education to whether it be junior high or senior high students, introducing them to the health professions, getting them ready for what it would take to make it all the way through to a graduate level medical program or a graduate level nursing program. And not only do they partner with the health education either at a bachelor's or a graduate level in those students, but they're also partnering with folks that are really even earlier on in their journey, providing them opportunities, resources, and education so that they can start along that path. And all of that is done, again, typically in rural and underserved school districts and high schools and junior highs across the state. So I, again, started to engage in some of that work as well, which was a little bit new for me. I hadn't quite done much of that work, but again, it really helped fan the flame passion inside of me for having individuals who are educationally, economically disadvantaged and teaching them about a profession, whether it be PA or other, and what it would take for them to be able to make it all the way through, graduate from high school, graduate from college, and then get into a graduate level medical training program. And that was extremely fun to be able to engage some of those young folks.
In your AHEC circles, did you ever learn of another PA who had been a statewide director of an AHEC anywhere?
That's a great question. No.
I'm not aware of anybody.
No. No. It's
pretty cool deal.
Yeah. Typically a physician or somebody who has a PhD or a doctorate specifically in something that would be good for statewide AHEC. But yeah, no, I don't think so.
So for those of us who have the passion for education, the PA education hooks never really let us wander far for long. So that clearly that's the case with you. You got reeled back into PA education. Tell us a little bit about your entry back into PA education at George Fox And tell us about George Fox.
Yes. So George Fox is situated in Newburgh, Oregon, which is a suburb about 35 or so miles outside of Portland. It's actually the community that we moved right to from Chicago 15, 16 years ago. So we moved right to Newburgh. So we knew about George Fox University, had several friends who worked there and kids who had gone to school there. And at the time, being the director of the statewide AHEC, I started to hear rumblings of a PA program that would be starting at George Fox. And I thought, wow, here's an opportunity to engage with the university right in my community to start a PA program. And I knew what that would entail. So I did not go into that not knowing the amount of work and energy and effort that would require. And I thought, okay, here's also an opportunity, as you said, to use all of this experience that I had gained through the 12, 14 years of PA education to then employ in starting a program. And I thought, what a great opportunity to take all of the best things that I've learned from Rosalind Franklin, from OHSU, to start a new program and to do that in my own backyard. And to do that, partnering with a university in a community that I had lived in for then at the time, 12 years. I'd raised my kids in this community. And so it just seemed like a natural fit for me to join George Fox and help them start the PA program. And then to use, again, as I said, all of the best of the experience and things that I had learned along the way to build a program from the ground up. One of the other things that really drew me to George Fox was their dedication and passion to service. That was really built into the mission and vision of the PA program. And so George Fox has a long reputation for serving the community of Newburgh and beyond. And so the PA program would really fall right in line with the dedication to service and producing PAs that are service-minded, service-oriented, to go out and not only practice as a PA, but also engage in their community, either as part of their PA job or in a volunteer role. And so the idea to continue that, which I had started to learn as AHEC director in terms of meeting some of the needs of underserved communities in the state. Again, I just thought this is a great opportunity for me to help build this program from the start. So I got hired in January of 2020, and then we all know what happened in March of 2020. We didn't have students yet in 2020, but of course, our preceptor recruitment, clinical site recruitment was brought to a screeching halt in early 2020 and on through the summer. But we continued, we persevered. And so then we started with our class in January of 2021. And yeah, it was amazing to be part of a program and building the curriculum and developing all of those clinical relationships with preceptors and with clinical sites, many of whom I had already had built over the course of the years, as well as access a network of brand new folks who wanted to engage with us and who wanted to be either preceptors or help us out with guest lecturing or even be part of our faculty. So that was really fun to be able to just build a team of faculty that were here, as well as build a team of preceptors and clinical educators that would help our students during the clinical year. And so, yeah, we started with our first class in January of 2021 and navigated all the COVID things as we all did through those years, and then have grown the program. Our first class was 20, have grown the program now to 6 students. That's our maximum class size, and getting ready for our final provisional site visit here in the fall.
So I hear you just returned from a international rotation experience.
Yeah.
You want to tell us a little bit about that? That sounds like something that might set your program a little bit apart and make it unique and perhaps attractive to applicants to PA programs.
Yeah, absolutely. Yes. So our PA program is, as all of them are, master's program. We do have a doctorate of medical science option for our students that want to dual enroll and then spend some extra time after they graduate with their master's completing their doctoral work. Part of the DMSC is a service trip of some kind that only the doctoral students go on. So it's, again, completely optional for the students to continue on and do their DMSC. But for those who choose to, a service trip is part of that. And again, just falling in line with the university, George Fox's mission-minded, service-oriented type of mindset and heritage, it really seemed like a natural thing for us to have a doctoral program and have that doctoral program be focused on global service. And so our doctoral students do a service trip, either international or domestic. And the international service trip is in Costa Rica. And so, yeah, I just got back a couple of weeks ago with a team of 6 students, 4 nursing students, nursing faculty, physical therapy faculty, and psychology faculty as well. that served various communities all around Costa Rica for 8 days. We ended up seeing roughly 450 patients, all of us together. And I think what was probably one of the most amazing things, besides just engaging with the communities, was seeing the interprofessional education that was happening between the nursing and PA students. We actually paired the nursing and PA students up together a couple times just to see how it would work to have them actually see a patient shoulder to shoulder, side by side, and do that work together. And the feedback from the students was overwhelmingly positive. They absolutely loved working with each other because that was really where they learned from, with, and about each other, as the pure definition of IPE states. And so it really exposed and opened the eyes of our students, as well as myself, to the tremendous need in other areas of the world, and to also just see what underserved means maybe here in the United States is different than what underserved or rural means in areas of Costa Rica. And so that was really amazing for us to be able to see how we had to adjust some of our care and some of the plans and some of the things that we wanted to do based on whether or not the patient had electricity in their home, or whether or not they were even able to get to a pharmacy, or let alone afford a medication. So it was really great experience for us, and awesome IPE that was happening at the same time.
That sounds amazing. Curt, we always like to give our guests the final word. If there's something we haven't had a chance to talk about or didn't ask you about that you'd like to make sure you share, we want to make sure you have an opportunity to do that before we close.
Yeah, I actually thought of something, Stephanie, per your other question, in terms of tell us about George Fox. One of the things that I didn't necessarily talk about or discuss was the PBL curriculum here at George Fox. And so our first year, our didactic year, is a primarily focused problem-based learning type of curriculum. And so our students spend 9 hours a week in their small PBL groups with the faculty facilitator going through patient cases. And then, of course, many hours outside of that doing student-directed and self-directed learning that then they come back and teach their fellow students about in their small groups, with faculty guiding their learning, making sure that the information that they're teaching is, of course, accurate. But then we also have traditional lecture courses as well that help supplement what the students are learning in PBL. And so we find it's a really nice mix of both active student learning in PBL, and then our students do have some traditional lecture style, more passive learning courses with some of our basic science courses and things like that. But we really feel like it prepares our students to really think clinically from the beginning, so that as they go into their clinical rotations and they open the door for their first patient and they walk in and start to engage with that patient, it's not the first time that they've had to think through that patient case, right? It's not the first time that they've had to learn how to navigate through a history, HPI, past medical history, physical exam, and then come up with a treatment plan, because they've been doing it every week over the course of the last year in their didactic year. Yes, that was, again, something that attracted me to George Fox. It was just a slightly different curriculum model with PBL. I was quite intrigued by that. And as I've obviously engaged in it, it's been a lot of fun to learn that new pedagogy and discover some of what we feel like are some of the advantages to preparing students for their clinical rotations with the PBL approach.
Curt, thank you very much. We really appreciate your time and the opportunity to learn more about your program and also just your unique background. I think it's a really cool opportunity to explain what AHECs are and share for our audience how they impact education, particularly when you have a focus on rural and community-based education. So we appreciate your time. We'd like to thank our guest, Dr. Curt Stilp, for his time and the information he provided about George Fox University's PA program, about the international component with their DMSC, and about his career as a PA. As you can tell from Steph and I, it is wonderful to have guests on with us that we go way back over 20 years, and it's been a great career for all three of us, and Curt, it's great to catch up with you. Thanks for taking the time. We also want to thank our episode sponsor, the PA Education Association. Tune in next time as we speak with the leaders of our profession, both nationally and worldwide.